Hi, this is Brian Kim. I'm going to share with you case number 55 in the Best Way to Do Cataract Surgery series. This is a soft lens with a very small pupil. And so you're going to see lens disassembly using double chop, cross chop, and mechanical fracturing techniques. Again, with these techniques, there is no ultrasonic energy or vacuum used to disassemble the lens. So I'm using a cotton tip to help straighten the eye out. This patient has a little bit of a Bell's reflex. Using a corneal marker to help me center and size my rhexis later on. Using the cotton tip to turn the eye downward a little bit and stabilizing the eye and make my paracentesis incision, which is going to be flat to the iris plane, first on the right side and then the left side now. That corneal shelf is very important, so it allows me to achieve that self-sealing corneal incision. I'm injecting some intracameral lidocaine and then epinephrine. You can see the pupil did not really dilate that much. And then I'm injecting some dispersive viscoelastic. Using the cannula to straighten the eye out. Again, this patient has a little bit of a Bell's reflex. I'm using an Orlock technique to turn the eye downward. Make my triplanar corneal incision. I make a vertical groove, place the blade in the deep part of the groove, use a cannula to turn the eye away, tunnel through the cornea, use a cannula to turn the eye toward me, and then enter. And that's the triplanar corneal incision. I'm using the forceps so I can make my puncture style technique. I puncture the central anterior capsule. In this case, it didn't really quite pull towards me. I'm using the teeth to gently tease the edge of the tear towards me. And then I grab the right side of the tear, making a flap, going around circumferentially. Again, because this is a small pupil, it just makes it a little bit easier to make my rhexis. So finish off the rhexis, burp some viscoelastic out. This will be the capsular fornix hydrodissection technique. I place the cannula underneath the rhexis edge, turn the tip down, get a nice wave, decompress on the left side, freeing it up on the left side, and then going with the cannula tip pointed down on the right side, and I'm going to get to spin the lens very nicely. Irrigating the surface of the cornea, making sure my sleeve is appropriate length. Lifting the incision with the chopper, going in with irrigation off to minimize Descemet's trauma. And I'm going to remove the surface epinuclear material, being mindful that this is a small pupil. And as I continue to do the case, you can see the pupil really shrinks quite a bit. I place the chopper out around the equator, point the phaco tip vertically subincisionally, crush the lens piece in half. This is double chop. Place the chopper out around the contralateral equator, pulling it centrally towards the phaco tip, crushing the right heminucleus in half. Using vacuum to pull that first quadrant up out of the bag, and then very carefully making sure I'm staying in the middle. I'm using high vacuum to remove the lens piece. You can see how much jiggling the iris is doing. I place the chopper out around that second quadrant, trying to tease it up out of the bag. Once I do this, I grab it with high vacuum and I'm crushing it between the chopper and the phaco tip. Again, using high vacuum, making sure I'm able to remove the lens piece carefully, using the chopper to manipulate the lens piece instead of trying to fish for it with the phaco tip. In this setting, if you fish for pieces with the phaco tip, you will grab the iris, undoubtedly. So it's very important to utilize the chopper, take advantage of the chopper, because the chopper will not accidentally grab the iris. You want to feed the phaco tip with the chopper. I turn the second heminucleus in front of me, place the chopper out to the equator, and then pull it centrally towards the phaco tip, which is deep in the bag. Divide that second heminucleus in half, grabbing the third quadrant with high vacuum, pulling it up, and then very carefully using the high vacuum to emulsify the lens piece, keeping it in the central safe zone. So now this is the fourth quadrant. I'm placing the chopper around it and then grabbing it with high vacuum, using the chopper as a guard so that I don't accidentally grab the iris with the phaco tip. So the chopper helps pull pieces up out of the bag. The chopper also acts as a guard, almost like an iris hook, to help protect the iris as I remove the lens pieces. So this is a very careful, systematic approach of removing a soft lens in a very small pupil. Again, very confidently and carefully, I'm able to remove the lens pieces without needing an iris retractor or an iris ring. So I grab the anterior portion of the epinucleus and it prolapses up quite nicely. I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INA handpiece. I start subincisionally, sweeping side to side, making sure I grab the anterior edge of the cortex, and then I start peeling it off. You want to use both mechanical peeling motion by peeling it up, by lifting the INA tip, and then activating the high vacuum. You don't want to activate the high vacuum when you're close to the iris, otherwise you might grab the iris. So you get occlusion, lift it up away from the iris, and then floor it with the vacuum, and then it pulls a piece up. It's a two-step technique. Once all the cortex is removed, I switch to the polish mode, and I'm polishing underneath the rexus edge. And then I'm polishing the posterior capsule surface as well. So you can see all of the movements are really not visualizable with this technique. But again, because of the polish mode, this is a very safe way to polish the anterior capsule. So I go straight to the cohesive viscoelastic, and I'm inflating the capsular bag, and then I'm injecting the single-piece acrylic intraocular lens into the capsular bag. So the leading edge of the lens is going into the bag, and the trailing end is left out of the bag. So I go in with the INA and then start the irrigation. And then I'm going to use a Maltzman, which will help me to confirm that the haptics are in the bag. So I could see very clearly that the leading haptic is in. I go underneath the optic, tilting it sideways, and I'm removing the viscoelastic from within the bag. When I do this maneuver and I see that it doesn't turn side to side, it tells me also that the trailing haptic is definitely within the bag. I'm retracting the iris edge, and clearly now I can see that the trailing haptic is also within the bag. I'm just confirming with the Maltzman, retracting the iris edge here, making sure that both haptics are in the bag. Once I'm confident that both haptics are in the bag, I switch to visco mode, remove all the viscoelastic from the anterior chamber. And in case the iris starts to do something funny, I have the Maltzman ready to help retract the iris if I need to. So I'm pushing BSS into the angle, making sure there's no viscoelastic trapped in the angle. I take the INA handpiece out, and then I hydrate my incision. So you can see this is a very small pupil. In the soft lens, I'm using double chop, cross chop, mechanical fracturing techniques. I'm able to do all the chopping maneuvers without vacuum, without ultrasonic energy. And the reason why this is so advantageous in this situation with a small pupil, floppy iris, when you use high vacuum, the iris might try to come towards you. With this technique, you have a lot of control. This is very safe to the iris, to the capsular bag. You can use a chopper as well to hook the iris, isolate it away from the phaco tip. Using the chopper as a retractor is also a very simple, elegant way to retract the iris so that you can emulsify the lens piece safely without involving or traumatizing the iris. And to me, this is really the easiest and best way to disassemble the lens. So I hope this was helpful to you, and I thank you for your attention.